I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today I'm going to talk about something which is very upsetting, something that is going to turn around anybody's life, plans, future. I'm going to talk about a word that we will not want to hear ever. I'm going to talk about cancer. Because nothing is more disruptive in anybody's life than when the doctor across you tells you, after reviewing your case, after reviewing the x-rays and the imaging and the laboratory tests and the biopsy and on and on and on, I have to tell you that you have cancer. I cannot imagine anything more disruptive. I can imagine that when somebody tells you that, like everything stops. Thank God I have never been in that position, but through the years I have seen many people facing a cancer diagnosis. And I don't have to lie. I have to tell you the truth. We all fear that word, including your doctor, including your oncologist. Why? Well, I'm going to say it very simply. Because in spite of the huge amount of information, of the millions and millions of dollars that have been spent in cancer research, in cancer therapies, in cancer diagnosis, in cancer, you name it, in spite of all of that, cancer is still a poorly understood disease. When we go to the doctor, they tell you, well, it's because you did this, it's because you did that, it's because of genetics, it's because it runs in your family, it's because sunlight, it's because of what you breathe and eat and everything. But nobody can really tell you what's happening. I'm going to use a very recent disease and problem that I could tell you about because it's going to let you understand what I'm trying to say. We just went through a huge epidemic, a huge pandemic. We just went through COVID-19 pandemic. And it's been what, 3-4 years? And after 3-4 years, we can tell what happens. If you go to the doctor and you say, I have COVID, what is this, doctor? Your doctor is going to answer in a very categorical way. He's going to tell you this is a virus. This is a virus that you probably got from somebody else. You probably went to the movies or went to a wedding, you went to a reunion, you were on the airplane, whatever. You got the virus and the virus started to develop in your body. And that virus produces a systemic inflammation. That's why you feel lousy, that's why you feel achy, that's why you feel very bad, because it's like just like if you had a really terrible flu, and one with a lot of steroids, a flu with steroids. That's what COVID is. And you can feel a lot of symptoms, but your doctor can tell you what it is. And it's been, what again, 3 years? 4 years at the most. Now we have a vaccine. And now we can tell a lot earlier when you get it, and we can even prevent it with the vaccine. We have learned a lot in the 4-5 year period altogether. And cancer we have been facing for many, many years, for decades. And cancer, as bad as it is, as much as we hate it, as much as we have spent in trying to find out what it is, the doctor will not be able to tell you, well, this is this, that you probably caught this way. She's going to give you a lot of information, a lot of theories, a lot of what's known. But it's very different from the case of COVID-19. This is a virus that you caught in that place. And no, we don't have a treatment for the viruses, but we have a way to prevent these side effects. And now we have a vaccine to prevent it. With this, it could have been this, it could have been your cigarettes, it could be your... And you know, when doctors tell you about cigarette smoking and all the bad habits that we know are connected to cancer, we are always talking not of a cause of the cancer, but we're talking about a risk factor. If you smoke, your chances of getting cancer are going to go up. If you eat right, if you keep your weight, if you exercise, your chances of getting cancer are going down. Not that either one produces or cures the cancer. They're simply statistically connected, those facts. With COVID, you can answer a lot of very solid answers for very solid questions, because we know what it is, we understand it. And with cancer, as I told you, it's still a poorly understood disease. That's why even we, the doctors, the oncologists, we all fear it as much as you do. With that scenario in mind, what can we do? How can we help ourselves? And to me, it's kind of one thing brings me to the next step. I have a potential problem, or I already have the problem. Either one. I have the potential of getting cancer, or somebody already told me I have cancer. What am I going to do? Well, nothing is more important than plan, strategy. If you have a plan, when the diagnosis is given, you're going to know what steps to take. You're not going to just panic. You're going to say, okay, this is the time to do this or do the other. So what I'm telling you is that we have to have a plan. That's how I call this program a cancer strategy. We have a terrible threat. What can we do? And then I created 3 steps to the problem. The first one, which to me is the most important, is, of course, prevention. If I can skip the problem altogether, fantastic. I don't have to face it. I don't have to have a PET scan. I don't have to go for x-rays. I don't have to have a biopsy. I don't have to have anything. I don't have to have any therapy. Fantastic if I can prevent it. My second one is, well, if I'm going to have a cancer, and I know, and we have done a program about this, we have a blog about this, if I'm a high-risk person, or just any person, I'm doing everything for prevention, what is my next important strategy? Early detection. Because I know that the sooner I find out I have a cancer, the more successful I'm going to be with the therapy. The less money I'm going to spend, the less suffering, the less everything. So, to me, my step number 2 is very important. I want to, if I couldn't prevent it, I want to find out as soon as possible. I want to find out when I only have few cells, few cancer cells in my body. So treatment can be mild, yet very effective. And the last situation, of course, is you have cancer. What am I going to do? And I'm going to use a word that we use many times, very frequently when we talk about cancer therapy. We say, I'm going to fight this disease. And fighting is what you're going to be doing. So when you're dealing with cancer, you're basically at war. And you cannot go through a war without any strategy, without any plan. You have to know where to put your soldiers. You want to know when you're going to use bombers. You want to know when you need a aircraft carrier. All that has to be planned. You have to have a strategy. And not only that, we frequently forget. When we see the news, when we see the wars, when we see everything happening, we very frequently forget, and what's behind all that? I'm going to use also a very recent example. They say, we need these big tanks in Europe to fight the war. Well, yes, fantastic. Here are the tanks. What are you going to do with them? You need a supply chain. You have maintenance. You have training. I mean, you cannot get off your car and get on a tank and drive it. Nor you can use those weapons and just shoot and kill the enemy. It takes months. It's not a secret. It's just that we don't think about it. Our soldiers, besides being heroes, are very well-trained people. They have gone to very important training programs. They know how to do things. And second, they have a supply chain behind them that provides them with fuel, with food, with everything. They need everything. They're fighting a war, but they're living people. They need to eat, to drink, to rest, to sleep. If they hurt, they have to be treated. They need a doctor. It's just a community like any other one, except that it's in the battlefield. So you need logistics to face that thing. That's what we're going to talk about today. Our 3 steps for a good cancer strategy. Stay with me. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today I'm talking about a program, a very special program that I have called Cancer Strategy. Why? Because I have already told you that a cancer diagnosis is going to be very disruptive. For those of you that have gone through it, and even if you don't have it, you have to think that we all have a life. We have something to do. We all have a family. We have things planned in our future. But when you sit across the desk and the doctor tells you you have cancer, everything goes to stand still. What about my wedding anniversary in 2 years? It's going to be my golden anniversary, 50 years of marriage. Am I going to live 2 years to get to that point? What about the big cruise that I had with all my family because I'm turning 75? We bought all these tickets and so forth, and now the doctor's telling me that I have cancer, that I have to go in the operating room and I have to do this. What is going to be my health in the next few months? Am I going to be able to travel? What about my retirement? I just went on retirement. I bought a mobile home. I was planning to do things with my wife, with my children. everything has to be disrupted. Everything has to go to stand still until you know what's going to happen. So I'm very sympathetic with how people feel when they're given a cancer diagnosis. That's why one of my big quests in medicine has always been prevention. Because when you think about cancer, my first and foremost, most important strategy is prevention. Do everything you can not to get cancer. And then some people will tell you, no, that's something you cannot manage because it's genetic. It's in your genes. Well, even if it's in your genes, and I have to repeat this because it goes with heart disease, it goes with diabetes, it goes with Alzheimer's, it goes with every degenerative disease. Even if it's in your genes, genes will produce the effect that you want or that you do not want when the gene produces a phenomena called expression. If the gene I have for Alzheimer has the opportunity to express itself, I'm going to develop the disease. If I have a cancer gene and I give it the chance to be expressed, I'm going to get cancer. But you know, God with all His wisdom has given us the opportunity to shut down, to silence the expression of certain genes. And how you do that? By being obedient, by having a healthy lifestyle, and so on. Unfortunately, cancer, like any other chronic inflammatory disease, is on the rise. We see more and more, and we see it in younger people. So don't get the idea, because I have heard it even from doctors when they say, we have more cancer today, not because we have more cancer, but because we diagnosed it better. Well, yes, I would buy that if I didn't have people with cancer in their 30s and 40s and 50s. I mean, if I were diagnosing more cancers in the age group that we used to have it 50 years ago, I would say, yeah, we're more effective with diagnosis. But I see younger and younger people. And I see a lot of cancers. I turn around, and when I began medical school, this is more than 50 years ago, I would turn around my family, my friends, the extended family, etc., and I barely remember anyone with cancer. And those that had it were 80 years or more. Today I turn around and I have many people that either have cancer or have died of cancer in their 50s or 60s. I know people with cancer in their 30s and even 20s. And I'm not just talking about the patients, because you might say, yes, of course, you are in a hospital that sees a lot of cancer. Of course, I'm going to see everything. No, I'm talking about people I know, neighbors and friends. So cancer is on the rise. Make no mistake. And if you truly believe that, you're going to be in the driver's seat, because now you can understand how important prevention can be. And we have the tools. The Centers for Disease Control in Atlanta, which is one of the highest authorities, health authorities in the United States, tell me that about 40% of current malignancies could be prevented by lifestyle changes. So it's not a mistake to think that the way we live is the way we're going to die. We have to be careful about how we live and how we take care of our lives. Because we're a living organism. So what do we need? We need BioCare. And BioCare means that we have to watch our life in general. And then you go to those risk factors that I was mentioning. First of all, you have to get away with tobacco, you have to get away with alcohol. Alcohol, the more I try to defend it, I always get a lot of bad news about alcohol drinking. So if you can avoid it, avoid it. If you have to drink something, I would go for an occasional glass of red wine, and probably no more than that. An occasional beer, and probably no more than that. And remember, those two things have one special situation. Those are naturally fermented drinks. But if you want to have a glass of a distilled alcohol, that's not anymore a natural thing. So if you can avoid it, avoid it. Or if you were going to do it on your wedding or New Year's Eve, okay, and that's it. Shouldn't be part of everybody's life. Tobacco has no place in human life. Tobacco is bad. One is bad. One every month is bad. Second-hand cigarette smoking from a friend in the desk next to me, it's bad. So tobacco has no place in human life. And then I have talked hours and hours and hours about good eating. I'm not talking about a diet. I actually hate the word diet. And I hate it because it implies two things. One, a sacrifice. I have never heard anybody joyful saying, "Oh, I'm on a diet." No, everybody is, "Oh, I'm on a diet. No, I cannot have this, I'm on a diet." It's always bad news. And the second is, how long am I going to be on a diet for? So it has kind of a built-in time frame. And what I'm talking about is good eating. How am I going to supply my body with the things my body needs? And everything goes down to a very simple question that we all have to ask ourselves. Every time you sit at the table, you have to think, why am I eating? What am I eating for? If you start answering those questions, you're going to see that everything is going to change. Because you don't want sugar, you don't want white flour, you don't want bad oils, you don't want garbage in your body. You don't want anything that comes from a factory. The Bible says that God provided us with food. And it's right at the Genesis. The fish, the plants, the fruits, the seeds thereof. And what do? We buy a can, a box, a foil paper, food that comes from a factory. That's not in the Bible. God never told us, and I give you a supermarket to buy your cans. I panic now when I go through a supermarket aisleway and I see milk that's not in the fridge. What it is, I don't know. And then we get surprised that we get chronic, inflammatory, degenerative diseases. So this is BioCare. I'm going to treat myself as the most precious living thing I have. I should treat myself better than my pet, better than my houseplants. As simple as that. I mean, we take care of fertilizer and everything. Now that spring is approaching, we start making sure that we put our sod is being well taken care of because I want a lush green garden for the summer. That's what you have to do with your body. What else do I have to do? Unfortunately, even if you try, you're not going to have a full nutrition. So you have to supplement. In this time and age, thank God, We have to, but we can supplement. So there are many things that have been left out in the food chain. Why? Because the agricultural methods, because the way we process foods, etc. Go to organic vendors, to people that have they love what they do, not to a food factory. And that's going to be a good beginning. Exercise. The more we move, the better off we're going to be. So make sure you get up in the morning, take the vacuum cleaner. You don't have to go to the gym. What about moving all the furniture in your living room and vacuum clean and put it back together and clean everything and dust? Those things count, and count a lot. There's a British study that shows that people that really work at home doing the homework develop a good health status. So you don't have to go to the gym. You don't need sneakers. You don't need anything. That's step number one. And we're going to go in the next segment on the step number 2. I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today I'm talking about cancer strategies. What is that? That is a plan that I should have in my head in case I'm afraid of cancer. And I'm sure we all are. And you say, what can I do? And I have divided it into 3 stages. 1, you don't have cancer. You have the opportunity to prevent it, to go around it. There is not any mystery in this thing. A good lifestyle brings health and longevity. I don't have to tell you that. I'm people that exercise a lot and work a lot and eat right, etc. live a long time. In the older generations, people die younger, but not because of chronic degenerative diseases, but infectious diseases. Now we have literally conquered infectious diseases, even COVID-19. It only took humanity 3-4 years to create a vaccine and to dominate a terrible pandemic. So we're good at that. But what happens with cancer? The same old thing. You have got to the doctor, they do surgery, you give radiation, they give you chemo, they give you this. It's very costly, a lot of suffering, a lot of pain, a lot of everything, and not exactly the type of results that we'd like to see. I already told you, cancer is a poorly understood disease. So the best thing we can do is take the strategy number 1. Prevent cancer. Don't let it come to you. Block it before it gets to you. How? With very well-planned biocaring. You're going to make sure of what you eat, how you live, how you exercise, how you move, how's your mood. All that counts. Stress is a precancerous condition. If you stress all the time, you can develop cancer. And we are so stressed. We have all these deadlines. We have all these problems. So we know when we are on a higher risk condition. Many people tell me, well, I have to do this. I don't have time to eat well. I have blah, blah, blah. You name it. I work a night shift, so I don't have time to sleep at night. Believe it or not, having a good night's sleep is very good in preventing cancer. A good, relaxing, restorative sleep can prevent cancer. Stress-free life can prevent cancer. Physical activity prevents cancer. And of course, healthy eating and healthy environment. So all that helps. But now, you are on a high risk factor, or whatever factor you're in, we go to this step number 2, vigilance and awareness. We have to think that no matter what we do, still we could get cancer. So we have to get ready with vigilance and awareness, because I know it. So I'm going to be watchful. And the minute I can locate a cancer cell, I'm going to go right after it. We have an immune system that should do it. That's why step number 2, prevention, is important. Because if we keep a healthy immune system, chances are that that cancer cells are going to be destroyed before they do anything. But let's say that didn't happen. So I have to be sure that as soon as any cancer cell can be detected in my body, I can go after it and destroy it. Or do a therapy when the therapies are going to be most successful, which is very early in the diagnosis. But to have an early diagnosis, we have to be proactive. We have to be very vigilant. And let me tell you why. Because cancer doesn't hurt. When it hurts, it's too late. Cancer is very sneaky. It's going to get into your tissue. It's going to produce problems before you can even tell. Same happens with all degenerative diseases. You can be diabetic for years before you know it. You could have high blood pressure and not find out until you have a stroke. You could have heart disease and not have a hint of it until you have a heart infarction. So you have to begin understanding that it is up to us to discover all these diseases very early. And with cancer it's important. With everything it's important. Remember this thing. The earlier you find out about a disease, the better off you're going to be. The less money you're going to spend, the less suffering you're going to go through, and the most successful the therapy is going to be. So we have to go for early diagnosis. And that begins with self-examination. I tell people every day after you shower, stand in the nude in front of your mirror and look at yourself and review yourself. And it's good if you have one of those mirrors, like when you go to the tailor, where you can watch your back at the same time. They're very inexpensive. You can put 2 of them at home, and also when you go to a party, you can make sure you look fantastic. Well, you look at yourself very carefully, let's say once a week. And remember, breast self-examination. And we have talked about aging of the skin, and we have told you that using moisturizers and those things can go a long way. So when you do that, you can feel your skin, you can feel lumps, you can find things before they give you a problem. Next time you go to the toilet, take a look. Remember in the French court, or also in the British court, when the king went to the toilet, he had the doctors examining the stool and the urine. And if you find anything that's not normal, then it's time to think and watch and even go to the doctor. So if you have a BM or you urinate, take a look. And you're going to get used to see what it is and how it behaves. You know, many people can discover intestinal flora damaged by that. If you get stools that go all the way down in the water, they don't float at all, they have very poor intestinal flora activity. You can watch it, and just some probiotics and prebiotics and just simple things, getting more fiber in your diet, etc., can solve the problem. So being watchful can go a really long way. And with cancer, You have to have a pap smear. You have to review your breasts. You can do cancer marker tests for prostate, for stomach cancer, for different things. You can talk to your doctor. A visit once a year to make sure that there's no any sign of malignancy can go really, really a long way. And I would recommend you to do it. An ultrasound scan, that doesn't involve any radiation. I know many people are very leery about being irradiated, but an ultrasound scan can go to your pancreas, can go to your liver, can go to your kidneys, can go to your prostate, can go to many organs, and just make sure that everything is checked. And if that's the case, you can go back with your life and be very happy. But if you find something, you're going to be able to tell and say, I'm going to treat it. And I could tell you about a lot of people that I have met that found the cancer very early on, and they're still alive and happy and productive. And no, they didn't have to go through big procedures, they didn't have to go through very long treatments, because they discovered it on time and went to the doctor. Lately, because of sequence in the genes, by what's called gene sequencing, we can find out if we have a cancer cell amongst a lot of things. So there are tests where you can, for example, put a stool sample, send it off, and they can look for malignant cells in the stool. And then you go for, once you have any positive result, then you go for ultrasound, you go for colonoscopy, and then you can locate a colonic cancer very early. They're now developing that type of test for different types of cancer, like just taking some of your urine. But to be successful in all those programs, more than a doctor, you need you. Because you're the one that lives day in, day out with yourself. You're the one that knows how you function. You're the one who knows what is there and wasn't there yesterday. You're the one that has to think in that situation, in that direction, because not that you're paranoid about cancer, but you're vigilant. And being vigilant is going to help you in many ways. You can discover a skin problem, you can discover a joint problem, you can discover a few things that can be very easily fixed. Talk to your doctor about it. You can say, doctor, I'm planning a strategy to make sure I can do, if I ever get a cancer, a very early diagnosis. And you're going to be very happy. And I'm sure your doctor is going to be happy to hear you say that. Because no one can help you better than yourself. Your doctor will not be able to do anything without your help and cooperation. So we have to commit first to take care of ourselves, but second, be vigilant of problems that are coming. And don't go anywhere, because we still have to talk about what if I have cancer. You are with Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. We're talking about a very important subject, and I think it's very important for everybody. We're talking about cancer strategies. What is that? Well, number one, we have to know that we're dealing with a potentially deadly disease. Cancer is a deadly disease in many cases. And in many other, it's going to take a lot of suffering and pain and expenses to deal with it. So there's no question about it. We all are fearful. We all are afraid of it, including your doctor and your oncologist. Because we don't have the full answer to deal with it. It's a disease that we don't fully understand. I have to say it. So many times you go to one doctor and you go to another doctor and they might have different opinions. And I was talking about, for example, COVID, when we know what it is, how it happened, we know the virus, we have pictures of the virus. You can see the virus and you can see the spikes and everything, and they turn it around and everything. Well, who causes cancer? What causes cancer? Has anyone shown you? Well, this is cancer. No, we have a lot of facts, but we don't know exactly what it is. We know that cells behave this way, that the body behaves this way, that the immune system, blah, 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 but no one can tell you, oh, look at the picture. This is the COVID-19 virus. We don't have that type of an answer. So we go here, we go there. So to me, I have divided my strategy with cancer in 3 steps. And the number one is prevention, because I know it can be prevented. How do I know it? Because the Center of Disease Control, which has to be one of the highest medical and health authorities in the world, let alone in the United States, tells me that many of the current cancers are preventable. So I have to believe it. I don't have any doubts about this institution. The second step is awareness. That I have to know that it can happen. So I have to use vigilance to make sure I know the minute it happens. I'm going to use an analogy. We have a home, we have an apartment, we have a car. And we know that one day somebody could be an intruder and steal things from our car or our house. So what we do? Number one, we prevent it. We put a fence, we turn the key, etc. But on the other one, we're vigilant. And in today's environment, many people have in their phone cameras in their house. And the cameras will tell to the phone that somebody is moving in your house, and you can take a look and you see who this person is. And you can call the police. That's vigilance. That's what we have to do. We have to turn on our video cameras in our body to make sure we're going to find out when something is going wrong. Take our blood pressure frequently, check our sugar level, check our eyesight, make sure we sleep well, get rid of our stress and our stress levels, and exercise and eat well and do things well, etc. But also go time to time to the doctor to have a breast examination, to do a pap smear, you name it, an ultrasound scan, whatever, to make sure we find out when cancer happens. The sooner the better. Because we know that there's a basic rule in medicine that says that the earlier the diagnosis, the cheaper, the easier the therapy will be. And more important, the more successful it'll be. But now we have cancer. You have a cancer. And the first thing I want to tell you, because I have fought with this situation for many years, is that when you say alternative medicine, when you say complementary medicine, I'm not telling you You have to drop this to do that. That's not the idea. When I say alternative medicine or complementary medicine, I'm talking about integrative medicine. I'm talking about putting things together. What can we do to help you? You have a cancer. We are fighting against that cancer. And you're taking a therapy that is working. Or you have a therapy that's not working very well. Whatever is the case, nevertheless, you have to understand that the therapy is only doing part of the job. A big part of the job is being done by your own immunity, by your own defense systems, and those need a constant backup. Remember when I was talking about when we are with the cancer, dealing with the cancer, we are at war, we're fighting against something. Well, you not only need white blood cells to fight the cancer. You don't only need drugs to fight the cancer. You also need resilience of the whole body. You need your body to be fighting back. You need your body being effective against anything that's abnormal in your body. So you need good nutrition. You need supplementation. We have to target what supplements might be more important for cancer fighting, like selenium, for example. And then you have to say, I probably have to supplement this. I have to check this. And be selective. That's what we call targeted nutrition or targeted supplementation. Your body needs energy. We have to provide the energy. I have seen so many cancer patients, for example, and those people that have cancer know I'm telling you the truth. One of the sneaky ways that cancer defeats us is by making us lose our appetite. People with cancer many times don't want to eat. Not only they don't want to eat, but they despise food. It becomes a problem. And we're fighting with the patient. Come on, just one more spoonful. No, I can't. It makes me nauseous. Well, at BioCare, because it is a full hospital, we use intravenous nutrition. And you can see the change. How the supply of energy is going to help your whole body to fight off that cancer. That's integrating. I'm not saying that intravenous nutrition is going to cure cancer. No, but it's going to back all the systems in your body to fight it off. It's that simple. We have to do everything we can. Exercise, for example, has been proven to be very effective in cancer fighting. It's becoming more and more an integral part of cancer therapy. Why? Because physical activity is very anti-inflammatory. Let's say you have a back pain. Oh, I have this back pain. What do we do? Number one, the first thing we do is we don't do anything. No, because my back hurts. No, you have to start moving. And when you start moving, gently but surely, remember the people that do Tai Chi, they're very gentle, but they're elongating muscles. If you start doing something like that, very gentle, you're going to see how the pain goes down because the swelling is going to go down. Well, that helps cancer patients. Many big cancer centers are now integrating physical activity to their therapies. Because if you lower the inflammation level in your body, drugs are going to become more effective. What about that? Did you know, for example, that if you have a high inflammatory level, even chemotherapy might not be working? And we have seen it. We have seen people that begin a cancer therapy, very successful, and all of a sudden stops working. Just like with antibiotics, when you develop resistance to the drug. Well, physical activity can beat that. And supplementation, and food supply, and energy supply. Actually, what you're giving the body is the energy it needs to fight back. It's the same thing that goes when you have a war. You can see the aircraft carrier back there, but behind you have tankers bringing fuel to the carrier and to the aircraft. Those things don't fly on ocean water. They run on very important fuels, and they have to be carried. There's a very complex logistic to make sure that this war is won. And that's what BioCare Hospital has done for many years. If you have cancer, we're not fighting with either or. Quite the contrary. We say, what can we do for this person to help them? We can do this therapy. Sometimes we will have to do a surgery. Sometimes we'll have to do, I don't know, a colonoscopy, certain procedure. But for sure, we know you need energy supply. And if you cannot eat, I'm going to do it intravenously. And I have seen people literally getting off their beds in 2-3 days simply because they were starving. They didn't eat anything. And as soon as they regain that energy, the cancer starts going backwards. Because we have a body that can fight back. That's what we keep forgetting. Even when you have a flu, they give you an antibiotic. The antibiotic is going to do part of the job, but the rest is done by your own body. If we don't have a good immunity, if we don't have energy resources, we're not going to win any disease. So think of all this. Review all this information. Share it with friends, and more importantly, you know you have a friend. Give me a call, send me an email. I'm going to be behind you. I'm going to give you free advice. I'm going to be guiding you by the hand. So don't suffer. Let's start working on this. Till next time, I'm Dr. Rodrigo Rodriguez.